DocTalk is brought to you by MERCK Animal Health, the science of healthier animals.
Hey folks, welcome to DocTalk. We're going to have a great show today. Our guest is going to be Dr. Mark Spare. Dr. Spare is an expert in anaplasmosis. He's an unbelievable bovine practitioner. It's going to be a great show. We're glad you joined us. Stay tuned.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America, a place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
If you're looking for advanced and innovative livestock handling products and facilities, Daniels Manufacturing Company is who you want to choose. They are a family-owned business that puts the needs of their customers first, and have so since they opened in 1958. With low-stress cattle handling being of the utmost importance, they are focused on quality, not quantity. The company prides themselves on prioritizing the animal's well-being by staying on the cutting edge of design and only using the best materials and manufacturing operations. For more information or to purchase your own, contact Daniels Manufacturing Company today. Closed captioning is brought to you by PROFUSION Drench for beef cattle, a no prescription, no needle supplement. To learn more, go to zenpro.com.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thompson, and I'm here with my friend and colleague, Dr. Mark Spare. Welcome to the show.
Thank you, sir. Good to be here.
It's great to have you on here, Mark. And Dr. Spare is a veterinarian here in the Flint Hills and the entire state of Kansas. Hails from the big city of Ashland, and just a pleasure to have you here. And we're going to talk about anaplasmosis.
Yes, sir. Absolutely.
So tell me a little bit about, what anaplasmosis is. Most people have a somewhat of an understanding, but let's kind of talk about what anaplasmosis is and what it looks like in your cow.
Yeah, that's a good place to start. So when we think about anaplasmosis, the scientific definition is that it's a gram-negative facultative anaerobe that infects the red blood cells of the host animal. And when we talk about bovine anaplasmosis, we're talking about cows.
Yep.
So when anaplasmosis penetrates the body, whether that be through a tick bite, a fly bite, or a needle bite, it infects a red blood cell, and from there it can go on and infect other red blood cells. The body then goes and sorts those red blood cells off, those infected red blood cells, and destroys them, and that's why we see an anemia result or issues or clinical signs result in these sick cattle.
So then, so it damages the red cells, and the animal clears or destroys those red cells because they're not normal. Now, what's that cow going to present if she's sick with anaplasmosis?
It's a good question. So when we see that the most severe clinical signs are in older animals, so animals 3 years of age and older, sometimes we see them in younger animals, and we can talk about that later. But about 21 to 30 days in, we're going to see an animal that's depressed, that's feverish. Sometimes they might be a little yellow around the eyes, and they can become hypoxic, which creates the aggressive cow that we all talk about in the textbook. Sometimes those animals aren't going to present that severe clinical signs. They may even stay with the herd and we not notice them. Regardless, once that animal either lives or dies past that infection period, they're going to go on and be persistent carriers for the rest of their life.
Yeah, and you said that is a problem in itself, because once the cows have it, the other vectors and things like that wind up being the issue.
That's one of the greatest realizations, the greatest summations of what I learned during my research work is that this is a disease to get into the other cows, to cows that haven't seen it, it has to be in the cows first. Now that's still a little bit of a chicken and an egg argument, but you can say if an environment does not have anaplasmosis in it, and there's none in the tick population, then to get it into that area, it has to come in through an infected cow. And then we can get infected ticks, specifically dermacenter ticks in our area and a number of areas throughout the Midwest. Flies can also then transmit it from a positive cow to a negative cow, or our own needle pokes can transmit it to a negative cow.
Yeah, so it's a bacteria that cows carry that then is transferred to other cows by ticks, flies, needles.
That's right. It's a blood-borne rickettsial disease, and we better use that word rickettsial to be scientifically accurate.
We'll get paid just a little bit more. But the we got 30 seconds here before break, but what are there other animals that can carry anaplasmosis besides cattle?
That's a good question. So we see some in some deer populations. Ticks become an important animal or organism that does retain an infection. However, it is a little bit different from other diseases. So a tick cannot pass it on to their young, which is important when we think about managing the environment and the infected tick population.
That's awesome. He's a wealth of knowledge, great veterinarian, Dr. Mark Spare. We're going to take a break here at DocTalk. We'll be right back after these messages.
Producers know stress costs money. It puts their cattle at greater risk of illness and can be a substantial drain on animal performance. That's why Zenpro developed PROFUSION Drench for beef cattle. Formulated with Zenpro's patented trace mineral technology, PROFUSION Drench is a no-script, no-needle performance supplement proven to rapidly replenish essential nutrients lost during times of stress. For optimal results, use PROFUSION Drench with Zenpro Performance Minerals in feed as part of a complete nutrition program. To learn more, go to zenpro.com.
CattleCon 2021 is back in the Music City. Tune in to Tennessee for the cattle industry's biggest convention, with education, networking, and fun, not to mention some great tunes. Plus, you can check out the huge NCBA trade show, outstanding entertainment, and much, much more. So make your plans and be there for CattleCon 2021. Stay tuned to convention.ncba.org for all the details.
4 generations before me did their job providing this opportunity to me and my siblings. If I do things right, I'm going to lay that opportunity out for my kids.
My entire family is a vital element of a job you have to get done.
You know, it's just fun to be around the family and doing this.
And you'll do the right thing for the business. You will do the right thing for the cows because it's for a family.
ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thompson with Dr. Mark Spare. Dr. Spare is a veterinarian and also has a PhD in diagnostic medicine and pathobiology that he attained here at Kansas State University. And we got to do a lot of cool research on anaplasmosis, and Dr. Spare directed that research and has published research on anaplasmosis and beyond. And so why don't you update us a little bit on the research front of things with anaplas?
Well, I appreciate Dr. Thompson and of course, ever the humble guy. Dr. Thompson did lead a lot of that research and allowed us to work with him. So a huge opportunity for the beef industry to bring in practical research, and I appreciated being a part of that. But just to bring up to speed a little bit of what we did through the diagnostic lab here at Kansas State, we were able to survey across the state of Kansas about 9,000 head of cattle, 900 operations represented, and demonstrate where in the state that we found positive herds. Not necessarily positive cattle. We did find positive cattle, but we wanted to describe it at a herd level, so a herd was either positive or negative. And what we found in the western side of the state, as expected, was the lower prevalence of infection, but we had a significant number of cattle infected in the northwest, far west, and southwest districts. In the middle of the state, we had about a 20% increase in infected herds, and so in the 45 to 65% of herds were infected in that central part of the state.
Yep.
And as expected in the eastern part of the state, we had between 78 and 85% of herds were infected. And the interesting thing is we did that research out west, we might have one animal infected out of the 10 that were surveyed per herd. And in the east, we might have 10 animals out of 10 that were infected per herd. And we went on and we asked some good questions, I think, to clarify who had used the vaccination, and the vaccination throughout the state of Kansas. And of course, it was used much more widely in the eastern part of the state than the western part of the state. But that gave us an opportunity to establish a baseline for the state of Kansas. Yeah. So it would be great to be able to repeat that study, in 5 years, and then we could get all of our epidemiology friends excited about head days at risk and use some big databases. But that was a great baseline for the state of Kansas.
Yeah, I think that understanding that geospatial tracking of the disease, and you think about people hauling cattle around the state and dropping them off, and as we talked about it being in the environment, I think that people out there, when they're moving cattle to different pastures in different parts of their state, should have an understanding that they may be moving it into an area that's hotter than what they were housed in to begin with.
Absolutely, and it was another thought along that line is that throughout that research, I had a huge opportunity, blessed opportunity to interact with a number of veterinarians across the state. And one veterinarian from eastern Kansas referred to his area, which had a high number of infections, as the epicenter of anaplasmosis in the state of Kansas. And I said, what do you mean by that? And he says, we have cases, we have severe clinical cases every year. And I said, we're in an area where more cattle are infected than not. Why would we have those clinical cases? And that just demonstrated for me as a young researcher and as a young veterinarian that there's a little more than meets the eye in terms of the endemicity of the disease or the stability of a disease in a region. And even where he had more cattle infected and probably some herds that were all infected, they would still have breakout clinical signs that caused issues in that area.
It's just it's such a fascinating disease. It's not fun, and it's so difficult to manage and that. But we'll get to that, folks. We're setting up for the grand finale on what Dr. Spare's doing. But vaccine. We got about 10-15 seconds. Vaccine, is it something that we think is good, as don't know, or not worth it?
That's a good question, and I really put it up against other vaccines, and I want people to step back and ask the question, how do I want any vaccine to work? And if it goes into the body, it's safe and it produces an antibody response. It doesn't have to be a sterilizing immunity vaccine for it to work, and that's what we expect the vaccine that we have for anaplasmosis to work that way and produce that result.
Great. Folks, Dr. Mark Spare, we're on DocTalk. We're going to take a break. We'll see you here after these commercials.
If you're looking for advanced and innovative livestock handling products and facilities, Daniels Manufacturing Company is who you want to choose. They are a family-owned business that puts the needs of their customers first, and have so since they opened in 1958. With low-stress cattle handling being of the utmost importance, they are focused on quality, not quantity. The company prides themselves on prioritizing the animal's well-being by staying on the cutting edge of design and only using the best materials and manufacturing operations. For more information or to purchase your own, contact Daniels Manufacturing Company today.
As dependable as the sunrise, in dairy parlors, open pastures, on ranches and feed yards across America. A place where reputation is more than a name, where the science of healthier animals is a way of life. It's the responsibility that drives who we are and what we do. Every decision, every day. It's your livelihood and our responsibility.
ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thompson here with Dr. Mark Spare. We're at the STANLEY STOUT Center shooting today, which is a lot of fun, in Manhattan, Kansas, where Dr. Spare is set up his practice in the Flint Hills, practices in southwest Kansas, all across the state, a little bit Oklahoma Panhandle. And Dr. Spare is a wealth of knowledge on anaplasmosis, but pretty much all things beef cattle, in my opinion. One of our rising stars in the veterinary profession. When we talk about anaplasmosis, you said, here we are, start of the summer. What are you telling your clients as far as identifying anaplasmosis animals in treatment?
That's a good question, Dr. Thompson, and I typically round so many days up, but today is actually July 2nd. I think about it as July the 1st. We're the 1st of July. And so those conversations for me are centering around, if we're in a fall calving herd, we're coming up on a period of time which is going to be an increased stress for this animal, for these cows. And as they're finishing gestation, maybe we're looking at an early August or an early September calving date. What are our opportunities to be on top of these cows and identify cows early when we have a sick cow? And we're thinking anaplasmosis is a potential. How are we gonna treat that animal without pushing it over the edge? And how are we gonna control that animal from interacting with the rest of the group? And I think the important thing to remember here is we talked earlier about that 21-day period where at the end of 21 days they're maybe at the height of clinical signs, the most severe. That animal may have a billion infected red blood cells, 10 to the 9th, per cc of blood. And so the risk that they pose to naive animals at the height of clinical signs is extreme, whether it be for vectors, whether it be for infecting new ticks, or it be, hey, we're working these cows and I'm going to use this needle to treat this animal, then I'm going to turn right around and use that needle to treat a different animal. We have to be aware of those things, that at that period of time, that animal poses the greatest risk to the naive cattle in the herd. Yeah. So identifying those cattle, again, it may be an aggressive deal. It may be that animal is lagging behind. We may be processing some cattle and, hey, this animal is really just down, depressed, has a fever. We have had a number of cattle here where we get called, hey, doc, this animal just went down in the chute. We were working them, she was kind of slow to come up, and now she's down in the chute. What do we do? And if we can humanely get her out of the chute, give her an opportunity to potentially recover, then that offers a potential. We do see a mortality with this disease of about 30 to 50%.
Wow.
So above 3 years old, we're gonna deal with that type of a mortality. Under 3 years old, we don't see that. But at this time, treatment is going to include fly prevention, and fly control. We're going to use LA200 as an opportunity. Baytril has been conditionally licensed as a treatment. That has yet to see at the end of a rope or in an acute phase how that works out for me clinically. And then chlorotetracycline is an opportunity. If we have an infected cow in this herd, how are we going to treat the herd?
Yep. So at the end of the day, we got to go to break here. Great observation on clinical signs, treatment, but wrestling those animals around is tough on them at that point in time.
Yes, sir. So as they're so hypoxic, we can really stress those animals to the point of death and push them over the edge. And there are areas of the country where we might not treat that animal, where, hey, this animal's by themselves, they're kind of by water, they've got some shade. Let's just leave her alone and see if she can make it to the next day, rather than transport her a couple miles or rope her down and treat her out there in the pasture and just push her over the edge. We can always try to help her back rather than get her back. CPR is unrewarding.
Yeah, and it's probably true with a lot of sick animals and different diseases, but especially true with anaplasmosis.
Yes, sir.
Awesome. Yeah. Great information again. Dr. Mark Spare, veterinarian, PhD in diagnostic medicine and pathobiology. You're watching DocTalk. Thanks for joining us. We'll be right back.
If you're looking for advanced and innovative livestock handling products and facilities, Daniels Manufacturing Company is who you want to choose. They are a family-owned business that puts the needs of their customers first, and have so since they opened in 1958. With low-stress cattle handling being of the utmost importance, they are focused on quality, not quantity. The company prides themselves on prioritizing the animal's well-being by staying on the cutting edge of design and only using the best materials and manufacturing operations. For more information or to purchase your own, contact Daniels Manufacturing Company today. Producers know stress costs money. It puts their cattle at greater risk of illness and can be a substantial drain on animal performance. That's why Zenpro developed PROFUSION Drench for beef cattle. Formulated with Zenpro's patented trace mineral technology, PROFUSION Drench is a no-script, no-needle performance supplement proven to rapidly replenish essential nutrients lost during times of stress. For optimal results, use PROFUSION Drench with Zenpro Performance Minerals in feed as part of a complete nutrition program. To learn more, go to zenpro.com. ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thompson here with Dr. Mark Spare, and Dr. Spare is a practicing veterinarian in Kansas. Tremendous resource on many different topics with beef cattle. Did his PhD working with anaplasmosis, and so, you know, it's something that we're seeing in all across the country, whether it's cattle from coast to coast, really.
Yeah.
And around the globe with anaplasmosis. And you've done a great job of setting us up, what it looks like, what it does, how to treat it. Now, what are some tricks or some things that you're working with your clients on preventing it?
Again, just really appreciate the opportunity to be here, Dr. Thompson, and the opportunity to interact with so many producers throughout the area, throughout the state of Kansas, Oklahoma, some in Nebraska, who want to tackle some of these problems head on, has allowed me to really utilize some different strategies in operations. We talked in the previous segment about whether we're a fall calving herd and we're coming on to calving. Here's one where maybe we're in a spring calving herd and we're actually going to be coming on, maybe we're going to do some early preg checking. We've already started preg checking some April turnout herds, and maybe we're going to start increasing in preg checking. So one of our first opportunities to think, do we have anaplasmosis in the herd? And if we do we need to think about changing needles every animal? We don't have a great handle on how that, if that is going to work as a standalone preventative method, but we do expect that is transmitting infected red blood cells from a chronic animal to a naive animal, and so that is a strategy to consider. We think about fly control at this time of year. How are we going to control flies, and realize that most of our fly control opportunities or options are not adequate tick prevention.
Right.
So our tick control products are different from our fly control products. What's our application going to be, and how are we going to deliver those? One of the main opportunities that we're talking about right now, and whether it be fall calving herd or a spring calving herd, is how can we deliver a therapeutic dose of chlortetracycline today legally in an approved method? And one of those opportunities truly is to hand feed, whether that be in a cake or a loose mix, a medicated feed. And we can take that out there to those cows and for a period of time, whether that be for 10 or 14 days optimally, or for an entire month optimally, to go ahead and reduce the amount of bacteria that's in those infected cows that we know about. We're managing that group of cattle as a herd, and it's a lot of work, but if we can save and prevent a couple of those deaths or sicknesses or lost performance by doing that, then it's a paying strategy for us.
Yeah, when you start to think about all the things you're discussing here, we're talking about clean needles, we're talking about tick and fly control, we're talking about then controlling it with medicated feed.
Yep.
All these things are things that, do you do that, as you try to protect your herd, or you're doing this after you have some clinical cases, or maybe, all the above? I don't know.
Truly, that question is open for debate and open for a little bit of contention, and as we think about the label directions, and we're feeding for control of anaplasmosis rather than prevention, and it's just the terminology that's been used in the industry. So as a veterinarian, I'm comfortable knowing the prevalence of anaplasmosis in the northeast part of the state, and recommending that we use these strategies to control what we expect to be active anaplasmosis. If it's in my neighbor's herd, it's right next door to mine, we need to get after it.
Ticks don't mind fences.
No, they don't. No, they don't.
Thanks for being on the show. Thanks for your knowledge and thanks for your passion for the beef industry.
Thank you, sir. Thanks for having me.
We appreciate you watching DocTalk. If you want to know more about what we do, you can go on the web and find us at www.doctalktv.com. Always work with your local veterinarian. I'm Dr. Dan Thompson here with Dr. Mark Spare, and we'll see you down the road.
Closed captioning is brought to you by PROFUSION Drench for beef cattle, a no prescription, no needle supplement. To learn more, go to zenpro.com. DocTalk was brought to you by MERCK Animal Health, the science of healthier animals. ValleyVet.com is your one-stop shop for your every animal need, from prescription meds, vaccines, equipment, and more for the ranch to the show ring. Shop ValleyVet.com for fast shipping and great prices.
Valley Vet Supply.